Are you a woman who served in the military and just wondering if you qualify for VA healthcare? You're not alone. Don't be like me and wait until 7 years after you get out of the military to start using VA healthcare. The system can be confusing, and too many veterans give up before even trying. But here's the good news. If you served, you may be eligible, and today I'm going to walk you through exactly how to access VA healthcare step by step. Let's dive in. First, let's talk about eligibility. Many women who served in the military just assume that they don't qualify, but that's not true. In most cases, you are eligible for VA healthcare if you served at least 24 months on active duty, or you were discharged for a service-connected injury or hardship, or you served in a combat zone, or you are a National Guard or reservist who was activated at the federal level. Please don't disqualify yourself before you even check. If you're not sure, you can apply and then let the VA make that call. And I'm going to show you how. The second step is to gather all your documents. You're going to need your DD-214, your discharge papers. And if you don't have a copy of that, you can request it. You can go to va.gov or archives.gov to request your DD-214. You'll need a government ID or your social security number, and then you'll need some basic information about your income, because some veterans may qualify for priority enrollment if they meet certain income limits. Here's a pro tip. If you've ever received VA disability, you may already be in their system. The third step then is to just go ahead and apply for VA healthcare. And there are 3 ways to apply. First, you could apply online, and that's probably the fastest and easiest way. So you go to va.gov/health-care/apply to start the application. Or you could apply by phone, and that you would need to call 877-222-VETS or 8387, or you could just go to your nearest VA medical center and apply in person. After you apply, the VA will process your application, and then they'll send you a decision, and that'll come through the mail. It usually takes about a week or 2, but if you have a service-connected condition, you might get immediate care. And by service-connected, we just mean that that's something that is wrong with you that can be connected back to your time in service. Step number 4 is what happens after you apply. Well, once you're approved, then you get access to a VA primary care doctor. Then you can also access women's health services like gynecology and maternity care, and you can get mental health support, even if that is not specifically service connected. And then you can also get low cost prescriptions. And then step 5 is to go ahead and schedule your first VA appointment. Once you're in, you'll call your local VA facility to book your first appointment, or you can use the My Health Yvette portal. If you need a specific doctor, like a female provider, you can request one. Also, the VA can refer you to private doctors if needed. And here's a bonus tip. There's a back door to the VA healthcare for mental health crises. So if you need urgent help, even if you're not enrolled in VA healthcare, you can walk into any VA facility and get free emergency mental health care. No questions asked, no paperwork required. Just say, hey, I need some help, and the VA is legally required to treat you. So if you are a veteran or you know someone who's struggling, please do use this lifeline. So now you know how to access VA healthcare. It's simpler than it seems. If this video helped you, please hit the like button and subscribe for more veteran resources, and share this with another veteran who needs to hear it. Drop a comment below if you have any questions. See you next time, and remember, you earn these benefits, so use them.